A new report by the Centers for Disease Control and Prevention ranks Oklahoma number 5 in the nation for the rate that physicians prescribe painkillers such as hydrocodone and oxycodone. And while Oklahoma ranks high, so does the nation, as Americans consume opioid pain relievers at a greater rate than any other nation. In fact, twice as much per capita as the second-ranking nation, Canada. And health officials warn that overprescribing such opioid pain relievers can result in several adverse health outcomes, including fatal overdoses. The Oklahoman's Jacqueline Cosgrove reports in the past 12 years, Oklahoma has seen the overall number of overdose deaths from prescription drugs more than double, and the number of deaths due to hydrocodone and oxycodone more than quadruple. Overdose deaths now surpass motor vehicle crashes as the leading cause of unintentional injury in the state, and they are the leading cause of death by injury for Oklahomans ages 25 to 64.
We're higher than almost the entire country. And it's a very good question. Unless you believe that Oklahomans have more physical pain or that we're a sicker population in general, the only explanation is that we just write too many scripts for the people in our population. And that's really what it boils down to. So the question then becomes, how do you change that and how do you bring that down to an appropriate level? Biggest tool that's out there that needs to be used is to make sure that physicians, when they're writing a script, they're actually checking what's called a prescription drug monitoring program. It's a great clinical tool that tells you, has the person that's been in front of you, that you're about to write a script for a controlled dangerous substance, is that person getting medication someplace else? Have they been doctor shopping? Do they have kind of a pattern of abuse that would be of concern? And right now, physicians are not required to use the PDMP, the Prescription Drug Monitoring Program. The states that have put this in place and required physicians to look at that have shown dramatic decreases in the amount of prescription drugs that are being prescribed. And as a result, a huge drop in the number of deaths. So we need to make sure that we're really using that. We're working with physician groups, hopefully to get there last year. We hope to get there this year in our legislative session. And we're met with some very steep opposition from the medical groups who didn't like the mandate on that. So we're hoping to educate those groups, help them understand the importance of this really robust clinical tool that has been proven to save lives. And we know physicians have the same end goal. They want to treat people, they want people to be healthy, and we need to help them understand the value of this tool. We have a lot of work to do with those prescribers to make sure we bring those rates down. Continue to see very aggressive work, again, from communities and law enforcement and licensing boards and individuals taking responsibility to make sure that we find our way to treatment and in recovery so that we can be stronger and on that path. But we have to all work together to get there.
You can learn more about this topic by clicking on our continuing coverage prescription drugs section on newsok.com.